Hi, I'm Dr. Joseph Baker from the Limerick Chiropractic Center, and I wanted to take a few minutes and introduce everybody to Shockwave therapy. Will you catch the shockwave? This is a new product that we're using at the Limerick Chiropractic Center in order to help people break free of some of the chronic problems that they've been experiencing and allow their body to go through a natural healing process to allow them to regain activities of daily living, release pain, and be able to enjoy life once again. Now, very simply, shockwave therapy goes by a lot of different names, but what this does, it's an acoustical wave, an acoustical sound that penetrates through the body with that high energy in order to break up scar tissue. One of the great things, the energy from the wave promotes a regeneration within the tissue. It allows for the tissues like the tendons, the ligaments, the bone, in order to have that healing energy pumped into it and for us to be able to successfully treat things like plantar fasciitis, neck pain, carpal tunnel syndrome, tennis elbow, low back pain, heel spurs, all different types of things that are highly inflammatory in nature. Now, it also allows us to be freed from the pain that is oftentimes associated with things like, trigger points. And when we start looking at myofascial dysfunctions, tendinopathies, soft tissue damage, scar tissue from previous surgeries, scar tissue from repetitive motion activities, similar to the things that I have done in my life. The constant adjusting over 30 years, the repetitiveness of running and cycling and other sports activities that have left micro traumas from behind. Now, some of us have done those things and we've done them in the sports world. Others have done those things in the world of our workplace. But regardless, we recognize that many of us have had those very same, if not similar, experiences that have led us to producing pain coming from different areas of the body. And wonderfully, we're capable of introducing this and allowing people the opportunity of finding out more about it so that they can be released from having those type of experiences. Now, some of the benefits of the shockwave happens to be the fact that it improves our mobility. One of the very first things that most individuals who have had this done in our office have stated is the range of motion that increases right away. The reason is because unfortunately scar tissue, fibrous tissue, is less elastic. It's not as flexible. What it does is it actually restricts the motion. And just like with subluxations, we realize poor motion leads to other things. Poor motion leads to the arthritis, the degeneration. In fact, in the spine, that restriction causes the disc to slowly wither and die. It's not invasive. The wonderful thing is that this targets scar tissue. Just like lithotripsy, it's designed with a frequency in mind. It passes through normal tissue and only attacks those broken tissues that have that scarring or that calcium deposit in it. The great thing is that we're not adding anything into the body. We are not removing anything from the body, which means that we're only stimulating the healing that already resides within each and every one of you. It reduces the pain, reduces pain medications. The awesome thing is that when we're not experiencing those pain signals, well, we're not reaching for the bottle of Tylenol or aspirin or Advil or whatever the painkiller of choice would be for you. As we're not engaging in those type of habits, well, the wonderful thing is that we're not adding to distress in our body. We're not delivering more toxins into our system, which eventually have to be cleaned up and gotten rid of. It's an outpatient treatment. We're capable of doing this right in the office, along with our normal adjusting, which is absolutely fabulous. This technique, this treatment actually helps to locate areas of problem. I oftentimes hear from our patients, "Doc, I felt fine until you touched that." Well, as you all know, only 10% of our nervous system even transmits a pain signal. And because of that, a lot of us don't know what's going on inside of our body. So as that acoustical sound, as that wave goes over that damaged tissue, it helps the patient understand where those damages are. And oftentimes it's helping to answer a lot of questions for those individuals so that they realize a little bit more about what's going on and why their body is functioning the way it is. Now, that also is one of those great things, because as the treatment continues on, those same areas that were pain sensitive, that pain drifts away because we're breaking down that scar tissue, we're increasing the blood flow in that area, we're allowing for a reduction in the inflammation that's inside those tissues, which means all of a sudden that pain level starts to drop very, very rapidly. We've had patients just like this morning who have, they are pre-surgical. They're scheduled for knee surgeries. And in fact, as they're capable of having this done, they had experienced the fact that they were able to go weight bearing, they were able to have an increase in range of motion, and they were able to do it without experiencing the same pain that they were prior to the Shockwave treatment. All of these things take only about 10 to 20 minutes as far as a duration for the therapy to be applied. Now, it is fast. And this is one of the wonderful attributes of this particular therapy. During each painless treatment, the laser increases the circulation, drawing water and oxygen and minerals and other necessary healing elements into the area. It's creating that optimal environment by reducing that inflammation, the swelling, and also the stiffness and pain. Finally, as the injured area returns to normal function, it's restored and the pain is eliminated. Now, let me just paint a picture for you. What this Shockwave does is very simple. It goes in and it literally busts up scar tissue. So that tissue that looked like a mesh is now being broken down, and it allows the body to let those fibers and those tissues realign once again the way they were designed to be. Like when we were young, and in turn, without those injuries. It's effective. It helps to eliminate pain, it facilitates healing, it reduces the local muscle tension, and it improves that circulation. I love the fact of how effective this process happens to be. And particularly with myofascial trigger points, the great thing is that it helps to relieve the body of the root cause of it and allows it to reduce the pain that's oftentimes associated with those very tender trigger points. Like when somebody grabs a hold of the top of your shoulder and squeezes a little bit, and you feel like you need to be, pulled off the ceiling, it aids in order to help to reduce that effect, to reduce those trigger points that are within those muscles, simply because the muscles are toxic and are not able to perform the way they're supposed to. Finally, it's very focused. It's painless. It passes right through the tissue, right to the affected tissue. I love that. It's short in duration, and in turn, it allows for the therapy to penetrate to the proper level. In fact, as we go through the therapy, we're capable of altering the level so we can dig into the tissue more and more and more. In fact, we can go as deep as the hip joint in order to actually deal with hip and shoulder issues that are oftentimes difficult to treat with other types of therapy. So in the end, I'm going to encourage you. If you've never had Shockwave therapy performed, and if in fact you would like to test this out, I'd encourage you to contact us at the Limerick Chiropractic Center for more information. I'm Dr. Joseph Baker. Have a great day.